Now, in the fourth section of our lecture topic, Cholesteatoma and chronic otitis media, we will talk about the Atticoantral type of chronic otitis media or Atticoantral type of perforations. We already talked about the tubotympanic type, which is a benign and little safer type of the chronic otitis media. In this section, we will talk about the investigations and pathology of Atticoantral type. What are the symptoms and signs, features indicating complications and treatment. So, Atticoantral type of chronic otitis media, it involves the postero-superior part of middle ear cleft and associated with cholesteatoma. So, in this type, Atticoantral type, cholesteatomas are present as compared to tubotympanic type, in which cholesteatomas are not present. So you can see posterior part and the attic or the top part is involved. So superior part of the middle ear cleft and is associated with cholesteatoma. Unsafe or dangerous type. As I already mentioned, tubotympanic type was safe or not dangerous or benign type. This is unsafe or dangerous type. Etiology or causes is seen in sclerotic mastoid. It's seen in sclerotic mastoid. Cause is sclerosis of the mastoid or the hardening of the mastoid. Investigations is examination of the ear under microscope. You can see examination under the microscope give us all the detail about discharges, perforation, cholesteatoma, location of the perforation. So examination under microscope, which reveal presence of cholesteatoma, its site and extent. Evidence of bone destruction if granuloma is present, condition of ossicles and pockets of discharge. Tuning fork test and audiogram. This is essential for preoperative assessment and to confirm the degree and type of hearing loss. X-ray, mastoid, CT scan, temporal bone. This is done to find out the extent of bone destruction and degree of mastoid pneumatization. Here, X-ray and degree of pneumatization. Pneuma is for the ear, so pneumatization if there. So culture and sensitivity of ear discharge to find out the causative organism, so we can start the specific antibiotic that's helpful against that specific microorganism. So all these are the different investigations that help us to find the involvement of the chronic otitis media, extent of involvement, site of cholesteatoma, type of deafness and hearing loss, and how it can be managed. Pathology is usually it's associated with cholesteatoma. There is also inflammation of the bone and there is granulation tissue formation, outer attic wall and postero-superior margin of the tympanic ring. Fleshy red polyp may be seen filling the meatus. Ossicular necrosis is present, which is common in the Atticoantral disease. So very common. Atticoantral is more dangerous, serious. There is involvement of the bone. There is formation of granulation tissue. Sometimes it is associated with the presence of polyps. Granulomas, cholesterol granulomas are also present, which is granulation tissue around a foreign body giant cell. And this is usually surrounding the cholesterol crystal. So it's all, these are different things, pathologies which are common in Atticoantral type of chronic otitis media. Symptoms are ear discharge. Ear discharge is very common, and sometimes this ear discharge, it sealed, it is when it dries and it becomes crusty, it may be sealed the external auditory canal. You can see it may be, there may be polyp obstructing the free flow of discharge. It can be scanty and foul smelling. Hearing loss is there, which conductive but sensory neural. Bleeding, usually you can see there is a bleeding from granulation and polyp when cleaning the ear. Signs are perforation, attic or postero-superior marginal type, retraction pocket, invagination of tympanic membrane is seen in the attic or postero-superior area of pars tensa. Cholesteatoma, which is pearly white flakes, can be sucked from the retraction pocket. Stages of retraction pockets. Stage 1, there is tympanic membrane is retracted but does not contact the incus. Stage 2, tympanic membrane is retracted deep and contacts the incus. Middle ear mucosa is not affected. Stage 3, middle ear atelectasis, and in stage 4 there is adhesive otitis media. So all these are the signs of chronic atticoantral otitis media. Is the unsafe, dangerous type. There is perforation in the attic or in the postero-superior area of pars tensa. There is cholesteatoma formation, which is white flakes that can be sucked from the retraction pocket. In stage 1, we have tympanic membrane is retracted but does not contact the incus. So slowly as the stages progress, it keeps on progressing. In stage 2, it reaches the incus. In stage 3, again, it reaches the middle ear, causes middle ear atelectasis. And in the 4th stage, it can cause adhesive otitis media. Features indicating complications. Very common pain, which is extradural persons, or usually there is perisinus, extradural perisinus or brain abscess pain. Vertigo indicate erosion of lateral semicircular canal. Persistent headache is usually intracranial complications. Facial weakness, there is erosion of facial canal. Listless child refusing to take feeds, usually is due to extradural abscess. So all these are the complications of chronic atticoantral otitis media: pain, vertigo, headache, facial weakness, and listless child resist to feeding. Some other complications, there is fever, nausea, vomiting due to infections, irritability, and neck rigidity. Especially these are the features common in meningitis when the infection reaches the meninges, which are the layers that cover brain and spinal cord that can cause the rigidity. There is diplopia when there is known as Gredingo syndrome. Ataxia is in labyrinthitis or cerebellar abscess, and there is abscess around the ear, which is mastoiditis. So all these are the presentations of different conditions. Treatment, we have surgical treatment to remove the disease and render the ear safe, to preserve or reconstruct the hearing. Usually the surgical procedures are of two types. One is canal wall down and one is up procedure, and these are the differences between canal wall up and canal wall down procedures. In canal wall up, the meatus is normal appearance. Dependence does not require routine cleaning of the ear. Recurrence or residual disease, high rate of recurrence. Second look surgery, requires second look surgery after 6 months. So rule out cholesteatoma. Patient's limitations, no limitations. Auditory rehabilitation, easy to wear a hearing aid if needed. So these are the canal wall up procedures requirements. Canal wall down, widely open meatus. Dependence on doctor for cleaning. Low rate of recurrence in this. The second look is not required. Swimming can lead to infection of mastoid cavity, problems in fitting a hearing aid. So all these are the different differences between canal up and canal down procedure, and this is done mainly to treat the Atticoantral type of chronic otitis media and to preserve the hearing loss. Then we have also reconstructive surgery, which is myringoplasty or tympanoplasty. If there is perforation, we can repair the tympanic membrane. Conservative treatment, suction clearance under operating microscope. That was all about the Atticoantral type of chronic otitis media. We talked in detail about the clinical features, causes, investigations, and treatment. Thank you for watching sqadia.com.